This meeting is now streaming. Good morning and welcome. My name is Dr. Lanny Wilson, co-chair of the Hope Taskforce, along with my friend, Art. I'd like to call this meeting to order. Out of courtesy for those who are speaking, please keep your microphones on mute unless you would like to speak or are being asked to speak. Dogs in the house often ask to speak, but only their owners know their language, so we'd like for them to stay silent as much as possible. As we begin our meeting, we must be aware of the following information. Since you know the DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment, this is in adherence to public health guidelines and for protection and safety of the public and staff. So, pursuant to Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120, requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions in 5 ILCS 120/7 limiting when remote participation is permitted are suspended. Pursuant to Section 7E of this Act, today's meeting is being conducted remotely and is being live streamed for the public's viewing. This meeting is also being recorded in compliance with the Open Meetings Act. Welcome. So I'd like to, after now officially opening the meeting, take a roll call, and I'm going to call names, and I'm going to, Thanksgiving, is only a couple of weeks away, right? So I want people to just say yes, I'm here and I'm thankful for, and I'll get started. My name is Lanny Wilson. I'm thankful for being reelected Vice President of the Board of Health. That just happened last evening. So don't just say, I'm thankful for my health or my family. Everybody knows that. Give us something unique about you. So Greg Hart, you're here.
I'm here. Thank you, Lanny. Good to see everyone again. And I'm thankful for the opportunity to be with this group again. As cheesy as it sounds, I know over the last couple of months, as we've been more ingrained in the COVID pandemic, the issue of substance use disorder has obviously been at the forefront of the news. And we all know that even with the pandemic, the health crisis that we're all gathered here to address is of equal importance. So I'm looking forward to diving into that with you all this morning. Thanks, Lanny.
You're welcome. Good morning. Mr. Bob Berlin.
Good morning. Welcome. I'm glad to be here. I'm thankful to be able to serve the people of DuPage in my capacity as state's attorney for 4 more years, especially during a time when criminal justice reform is at the forefront, and we expect to see changes in Springfield, and I'm just thankful to be part of that discussion and part of this group.
We're thankful too, Bob. Is Judge Guerin with us today or a representative? No one from Judge Guerin's department. Is Rich Jorgensen here? Rich Jorgensen ran a tight race, and I was so happy to see that he's with us, continues to be with us. Rich is the coroner who helped spread the light on the problem that we're addressing today, not only for DuPage County, but for the whole country. So hopefully Rich will be able to join us a little later. I think I saw Darlene Rossetti.
Morning. Good morning. I'm thankful for my staff at the Regional Office of Education. They work tirelessly and during this time and doing a lot of good work out there, especially in the area of mental health. So I'm thankful for this morning.
Great answer. And Mike Drugan is here for Sheriff Mendrick, I think.
Yes, sir. Good morning, everybody. I think on behalf of the Sheriff's Office, I just think that we want to thank and be lucky enough to have all of these people helping us in our mission. We know that none of us can do it alone. And I think by the partnership that we truly have here in DuPage, it really makes things go very far. So I appreciate everybody on this call.
Thanks, Mike. Is Grant Eckhoff here? Grant Eckhoff with us this morning? Jeff York, I think I saw you. There's Jeff.
Morning. I'm Jeff York. I'm the public defender for DuPage County, and I'm thankful for the really nice weather we've had the last couple of weeks. With everything else, it's nice to have some nice weather to appreciate while we're dealing with everything else.
That's a great answer. You're so right. Has Karen arrived yet? Karen Ayala? Karen's seeing
Yes,
oh, there
yes,
you are. Hi, Karen.
I'm here. Thank you so much. Very happy to be here, and I'm thankful for the amazing team of people that I get to work with, both within the health department and throughout the community. And I would, looking at the pictures, I would count you all in on that broad team. So thank you very much.
And your team is thankful for you, Karen. Thank you so much. I think I saw Bernadine McFarland here, didn't I?
Yes, I was actually, hi, I'm Bernadine McFarland. I'm the program manager for the problem solving courts, specifically drug court and focus that we discuss a lot in this task force. I am very thankful for my team led by our judge who was not able to make it today, but I know she was on the meeting at the last meeting, Kavita Athanakar. And all of you, like Karen said, I would echo that. I feel like our extended team is the task force. We're all on the same mission, and I'm very grateful and thankful for everyone's help, because somebody else said we can't do it alone, and I would echo that sentiment as well. So thank you all.
Welcome, Bernadine. Glad you're with us today. Greg Vesta with the DuPage Police Chiefs Association.
Thank you. Good morning, everyone. I guess I would just say something that I've been thankful for many years is being a part of DuPage County. We really do things right in DuPage County, and from law enforcement to public health to mental health. It's really an example that's shown across the state on many occasions for how we do things. So I'm proud to be a part of this task force too. So thanks for having me this morning.
Great answer. DuPage Fire Chiefs Association, Keith Creston.
Good morning, everybody. Keith Creston from Lyle Woodridge Fire District, also representing the DuPage Chiefs. I'm thankful that I got a kid on my department that has done a lot of good work with the Narcan training, John Caldwell, and been able to do a little bit of our part in addressing the pandemic, the opioid pandemic, and I look forward to continue working with this group to continue doing whatever we can to make a difference.
Thank you so much, Keith. Mayor of Addison, Rich Veenstra.
Good morning. Certainly thankful to be part of this organization, but also on a personal note, thankful that my son and daughter-in-law gave me my 4th grandchild the night before last.
Wow, that's great. Great answer, my friend. Nothing like family and those special additions to it. Executive Director of Gateway, Jim Scarpace.
Thank you. Hi, everybody. Yes, I am thankful to be here. And, on behalf of Gateway, we are thankful to continue to be able to provide both residential and outpatient treatment services to both the residents of DuPage County as well as the Collier County. So we continue to do that and hope to be able to continue to do that in the coming months.
Perfect. Thank you. We're so glad you're with us today. Is Michelle Warbeck with us today? Michelle just recently moved back to Ohio, and she's doing remote work. And so I thought she might be with us, but since she's leaving her role as Vice President and Chief Counsel at Task, and as you know, Task is Treatment Alternatives for Safe Communities. Since she's left that position, she might be leaving her position with us. So we're sorry to see her leave. Her voice has been compassionate and strong. So we will look, sadly, probably for a replacement for Michelle. Is Allison Johnson with us today? Allison Johnson. Allison is with CDH Del Northwestern Hospital. Is Lisa Svak with us today? Community Development? Lisa's not here. Okay. I saw Brad Gerke, I think. Brad?
Yeah, hi, good morning, everybody. Definitely thankful for everybody here on the Hope Task Force taking on the opiate crisis head on. Thankful for everybody that's in recovery right now that's fighting the good fight. Thankful for my Banning Treatment Center team that's working tirelessly around the clock. And September 14th, I celebrated a decade of continuous sobriety.
Hey, that's worth celebrating, man. That is such good news. Thank you.
Thank you.
Deb Lewin here with Path to Recovery.
Good morning, everyone. I'm grateful to be working with all of you. But today I'm really grateful for our veterans. It's Veterans Week, and I'm a military family, and I'm most grateful for being able to celebrate Thanksgiving with my son, who is now serving. It's been 2 years since I've had a Thanksgiving with him, so I am so grateful for that.
Very good. Laura Crawford, President, Chamber 630. You're
Good morning.
There you go. Thanks.
Good morning. Well, like others, I'm very, very grateful to be part of this task force, and I so much respect everything you've already accomplished since you started, and I look forward to the future. But I'm a pretty basic person, and I'm very grateful that the Masters is on this weekend.
That's okay. That works.
Takes me to a beautiful place.
That's important. And finally, Andrew Ensom, Director, DuPage Metropolitan Enforcement Group. Andrew here with us.
Good morning,
today.
everybody. Good morning. I'm grateful for all the support that DuMeg has received through my couple of years as director from the Chiefs Association, the State's Attorney's Office, and DuPage County.
Perfect. Welcome aboard. Greg, I took a couple of minutes longer than I was supposed to, but hopefully it was worth the time. So next part is yours.
It's always worth the time. Absolutely. I do also want to recognize a couple other folks on the phone. I do see my colleague, member Jim Zay from the DuPage County Board. Jim, thanks for being here. I don't know if you wanted to say a couple words to introduce yourself. Either way, just wanted to recognize you on the phone.
Oh, thanks, Greg. Just honored to join all of you today.
Great. Thanks for being here. So the next item on the agenda, and we'll make up some time here, I think, Lanny, is the approval of minutes. I think everyone on the task force had that emailed to them. I'll ask right now at this point, are there any additions, corrections, or deletions to the minutes, or do we have consensus on how they're written as currently stated? Seeing no additions or corrections or proposed changes, I think we'll have consensus on those minutes, and we'll deem them approved. Is there any public comment, Penny? I don't believe there is. I think Penny's on mute.
No, sorry. No, there's no public comment.
No worries. Great. Well, so we'll move on with the agenda. So everyone should have it in front of them. We have a really great agenda this morning on some very timely topics. And as we alluded to, the one thing that we all recognize we're going through right now is the COVID-19 pandemic. And that certainly does have some impacts on the mission we're all here to address. So first item on the agenda is an update on the COVID-19 response from DuPage County. And Executive Director of the Health Department, Karen Ayala, I believe is going to cover that. So Karen, I'll turn it over to you to give us that update.
Thanks so much, Greg, and thank you all for joining us. I have a couple of slides that we prepared for our Board of Health meeting last night, and Chris, thank you for helping pull those up. I think we have all heard about the increases in the state, in our county, in the region, in the country. And certainly I would encourage you to check out, if you haven't yet, check out the dashboard. But what I provided to them, because I think sometimes we get too into the numbers and they become either nonsensical or just completely overwhelming. So I want to first pull up the fact that yesterday IDPH announced 12,657 new cases. We in DuPage County announced 804 new cases of COVID that had been diagnosed. What we're seeing right now is the exponential growth that we had seen earlier in the spring. and it led to our calls to flatten the curve. We're seeing that again, only this time it seems to be kind of in hyperdrive. So when we look back even 30 days being something that seems like a fairly limited period of time, and with monthly meetings, it seems like just yesterday we've seen a 336% increase. So on 10/9 we announced 127 cases, and on 11/9 we announced 554. And since the 9th, again, those numbers have continued to climb. We've also, and this is very concerning, we have also seen the daily hospitalizations increase. And so by 300%. We are seeing, and Chris, I don't know if you could pull up that one graph that we used for hospitalizations, curveball. But we back in September, the end of September, we had almost 5 new hospitalizations a day. And on 10/25, we're seeing slightly over 18 hospitalizations a day occurring. And of course, those hospitalizations accumulate because although we're seeing shorter periods of hospitalization, still it doesn't take long to stack those individuals up. And what we're showing you now is the graph that we receive on a daily basis. These are the numbers that hospitals are reporting on a daily basis. This represents all hospitals in DuPage County. So not all beds at hospitals in DuPage County are filled with DuPage County residents, acknowledging that. However, if a bed is filled, a bed is not available for DuPage County residents. So we've seen since the 12th of October to now quite the increase. And of concern, we've seen not only hospitalizations increase, but we've also seen the blue bar has increased with ICU. And again, one of the challenges that we've been facing with is sometimes we talk about COVID-like illness. These are all diagnosed COVID patients. So again, we're seeing a concern around that as well. And then back to the slide. We're also seeing test positivity. So back at our low point, we were actually around 2-3%. Even in October, we were under 6%, and that has now increased dramatically to 13.2%, and again rising. That resulted in us being placed in Tier 2 mitigation by the governor through his resurgence plan. So once again, the IDPH and the governor's office are really encouraging people to work at home if possible. We know the less that people are out and about and the more that they're sitting and watching the Masters golf tournament, the better off we all are. So thank you for doing your part, Laura. If you have to go out, please only for essential activities, medical appointments, treatment meetings, those kinds of things, grocery store, but perhaps some of the other activities could be curtailed, is our recommendation. And then we're continuing to see concerns around travel and gatherings, both gatherings outside of the home and inside of the home. And so we are once again making some internal kinds of recommendations on how many staff, how our staff are operating, and what are essential services. The other update that I'd like to provide is around testing, and that is that too has just experienced exponential growth. Those of you who work in the courthouse on the county campus, I apologize because although our testing site opens at 7, I'm told that cars are starting to line up at 5. By 8 o'clock at the latest, we have 600 individuals already queued up for testing for the day, which is our limit. We also are facing at this very critical time the unfortunate prospect of having to actually reduce capacity because of the winter weather. We'll no longer be able to have that big tent, open tent. Instead, what we, it's unfortunate, but at least we have it. We have a enclosed heated structure that our testing staff can be under. Will remain at the county, on the county complex, but we will have a reduction in test capacity. So we are looking to expand our testing through partnerships with IDPH. We are also looking within the next week or two to be able to announce another community-based testing site that is completely funded by our current allocation of CARES dollars through the county that can help pick up some of the capacity for our community residents. So that's kind of an update on COVID, but I thought it would be helpful to hear from our treatment providers about how COVID is actually impacting substance use disorder treatment, and what kind of creative, innovative strategies have been developed. Because again, it's the virus we're fighting, not each other, and so maintaining these essential services is oh so critical. So Jim, I don't know if you can lead us off.
Sure, I'd be happy to. Thanks, Karen. Yeah, it has been a very challenging time, especially for individuals who struggle with substance use disorder. And I say this a lot in conversations I've had, since this all started in March, that, we have to balance two very crucial things, which is a pandemic that's, sweeping the country and sweeping our state and our community, and a disease of the brain, which kills people every day. And unfortunately, during this time has become more progressive and significant in its acuity. And so we've seen an increase in opiate overdoses, not only in DuPage County, but across the state. We've seen mental health issues, suicide risk, suicide attempts go up, increases in depression and anxiety because of all the changes that we've all had to go through. And so at Gateway, we're trying to balance the fact that, yes, we want to make sure and minimize the chance for someone contracting COVID as a result of treatment or being at our center. But we also know without treatment, these individuals will die of a substance use disorder, will die of this disease. So it's been tricky. When we started in March, we were kind of caught off guard, as everybody was, in terms of what is best practice, what should we be doing. We decided at that point for a short time to shut our residential program down for a couple weeks to get a handle on the existing clients and making sure they were safe, of course, that were already in our treatment centers, and making sure we had a good plan moving forward. So as we brought new clients in, we could assure, or at least to the best of our ability, assure their safety. And so, when we reinitiated residential, at that point, we decided in April, May to bring outpatient to just a virtual platform. So we stopped outpatient face-to-face services, which was challenging because for a lot of individuals with substance use disorder that are in outpatient, the virtual platform, although helpful, is not the same as face-to-face contact, and not only the accountability, but the support that individuals will get with a substance use disorder in a face-to-face outpatient program. So that being said, we did decide in summer, as the numbers started to go down, to bring outpatient back face-to-face and run a parallel virtual program at the same time so that clients could choose between virtual if they were more medically compromised or at higher risk for COVID, and at the same time also offer a face-to-face with social distancing, of course, and everyone is masked here at the center when interacting, both staff and clients. Everyone's temperature is taken. We put that measure in place in late March, right when all this started to occur. And we were able to really run two parallel outpatient programs for a while up to this week. As of this week, with the numbers increasing, we did stop the face-to-face outpatient, or will stop it as of Monday, and go back to the virtual platform temporarily And this is we're telling clients that, our goal is to do this and, meet the best interests and make sure that both them and the community is safe. And we're going to continue to work with them. And when we're able to return to face, we will bring them back to the center. So yeah, it has been challenging that way in residential, even more so. Again, everyone is masked in residential. Everyone's temperature is taken every day. We're not able to bring clients in that are symptomatic or have been exposed to COVID without a negative test prior to coming in. And then of course, when they get here, we test everyone. Our nurses test everyone upon admission. So it takes about 2 days to get those test results back. And during those 2 days, clients are, I won't say quarantined, but they are separated from the rest of the milieu until we can ensure that they're negative, even though, again, everyone's wearing masks in groups. The only time in residential clients aren't wearing masks is at bedtime when they're sleeping and when they're eating. And when they're eating, we're, making sure our cafeteria or our dining room tables are separated. As units leave, the kitchen team cleans everything. It has been a really challenging time, but what's important to us is continuing to meet the needs of the clients we serve. I mean, that's our mission. And again, regardless of funding source, we want to make sure that, if clients need treatment, that, they can access it. We did have to limit the downside of all of this. It sounds like a lot of upsides, but in terms of helping clients, but the downsides is we don't have the capacity we used to have because of social distancing, because of even residential, making sure there's space in rooms. We can't serve as many clients as we were able to serve before. And that's that balance, unfortunately, between the pandemic and their safety and trying to help individuals with substance use disorder. So that's been hard and challenging. The other challenging part is we've been really fortunate here at Aurora. I've only had, out of the hundreds of clients we've served since this started, I've only had 2 positive COVID cases in residential. Both of those clients were, had to be convinced that they had the illness. They were asymptomatic. They didn't have any symptoms at all, and we had to help them get set up in services. One of the things we've done at our Lake Villa facility is we've created a COVID positive unit for clients who are asymptomatic and test positive at some of our other centers. Instead of sending that client back home to the community, we give them the option of going to the Lake Villa Center. Of course, everyone there, just like here, is in full PPE when they're working with clients, even more so there. And we've had about 10, 11, 12 clients, I'd say, since this all started that, were part of that unit or could be part of that unit at any given time. And none of the staff have contracted the illness. The personal protective equipment, the masks work, as we've heard, in terms of even working with clients who are COVID positive. Staff haven't contracted that illness. So we continue to do that. We have to continue to enforce and reinforce the importance of masks, because as time goes on, sometimes people get a little bit lackadaisical about that and will drop their mask below their nose. And so there's some policing that we have to do. But for the most part, considering how it could have gone, I feel like it's gone pretty well in terms of trying to balance both of those things. Any questions?
Thanks so much, Jim. Karen, I don't know if you want to update us on Haymarket and any creative strategies that you've employed. Thank you.
Sure. At Haymarket, we have the same balancing act that Jim just talked about. In Chicago alone, the Chicago Department of Public Health published their statistics on their mid-year statistics on opioid-related deaths and emergency responses. And between the timeframe of January 2020 to June 2020, there was 7,031 opioid-related EMS calls and 573 opioid-related deaths in Chicago. This is a 60% increase in opioid-related EMS responses and a 58% increase in opioid-related deaths. So you try to balance that with, as you may be aware, Lori Lightfoot announced a stay-at-home advisory in the city. So we try to balance both those sides of the equation. It's affected all of us. The hardest hit are obviously those with mental health and substance use disorders. We have been testing all patients and staff We've done about 3,500 tests across the agency since COVID started. We do screenings twice a day. We've done biometric cleanings at the organization. Obviously, we're trying to educate staff and clients. We're trying to do gentle reminders. If you see something, say something. Everybody should have their mask on. Everybody should socially distance. We've done things in our cafeteria where we don't allow people to eat together in different programs. We actually deliver food to the programs. Every program moves together, so we don't intermix programs at all. We try to keep groups of people together. Before people come in the organization, clients, we test them. And right now we have, we're the first congregate setting to have a Bionex Now lateral flow test that is able to detect COVID symptoms within the first 7 days. So we would isolate the patient and wait for that testing, which should come back between 15 and 20 minutes. And then they go through assessment and we put them in programs. We have Zoom rooms where we do telehealth, telepsychiatry, and the such. Again, it's not necessarily the same as face-to-face interactions, but we're doing our best to try to provide the support we need and our clients need. We have reduced the number of outpatient, we've reduced visitors. We had Dr. Gianna of the CDC come in with the Chicago Department of Public Health, walk through our facility and provide us guidance on what we can do to keep our patients and our staff safe. And we've been blessed with some wonderful partners in Heartland Alliant Health and Rush that helped do training early on back in March and April to really set us on a good path. And in March, we also were part of the Chicago Homelessness and Health Response Group for Equity. There were 20 different partners from the Chicago Department of Family and Support Services, Cook County Health, A Safe Haven, Rush, Northwestern Medicine, University of Illinois, Chicago, and we all work together to distribute PPE and provide educational resources to each other, to provide a safe transfer place for people who are homeless. Because as you may recall, 82% of our population who we serve in the West Loop has a history of homelessness. So a place where people could be transferred if they did test positive because we couldn't keep them in our facility. We do have isolation spaces and we're doing a lot of training as much as we can with our patients and clients to kind of keep people safe. Right now, we're responded to this latest stay-at-home advisory by Mayor Lori Lightfoot to try to figure out what we can do to keep essential staff in our facility and those people who are not essential, meaning front-facing to the clients and critical to continue operations, security, facilities, housekeeping, what we can do to provide a work at home or work remote environment. So those are some of the things that we have been doing as an organization to keep people safe. I might add that our census remains very strong. People are still coming to Haymarket Center. Our men's programs, our men's residential is 90% filled. Our women's residential is 70% filled, and our recovery homes are 80% filled. So we still have hundreds of patients who are in our facility daily seeking treatment, and we have to be able to staff appropriately and provide them the services they needed.
Karen, are you muted?
Yes,
Yeah.
sorry about that. Thank you so much, Karen. Brad, I know that both through your work with Banyan as well as the other work that you do, you have most likely been impacted and would invite you to share.
Yeah, of course, thanks. And Jim and Karen couldn't have said it any better. I mean, it's been, the treatment industry has been flipped upside down just with new policies, procedures at the forefront, making sure that our patients and our staff are safe and protected. So you guys said it great. So I guess I can touch on, just the recovery community and what's been happening out there. I'm almost embarrassed to say, but I've lost a count on how many people I've known that have passed away from this disease since this pandemic started. It's been ripping through people with substance use disorder that have been in active addiction and relapse rate as well. You know, I will say that there is always hope. I think in addiction, very easy to adapt to circumstances. It's just the newcomers is who my heart goes out to, is because of the just blatant confusion on, is there a meeting tonight or isn't there? Is it in person or is it on Zoom? People in early recovery may not have the resources, just as simple as having a cell phone or a computer, to be able to log on to some of these you know, meetings, to be able to get that support. You don't have that meeting after the meeting to where they can talk with the sponsor, get plugged in, or go out for a cup of coffee. You know, it's been challenging. There's no other way to put it. So I would say right now, for people that are trying to get sober, being in treatment is probably one of the best places that they can be, because at least they're getting plugged in, they're getting the support, they're getting the face-to-face, or if you're doing it via Zoom, you're connected somehow, some way. And those are for the people in early recovery. People in long-term recovery, I've heard, and including myself, you know, mixed opinions. Some of it's cool because we've had friends that have moved out of state, you know, whether it's Arizona, Las Vegas, North Carolina, and you're able to have these Zoom meetings and connect and kind of see what's going on nationwide in the recovery community. You know, some people are having meetings at their house in the backyard. Now that it's getting colder out, I'm interested to see what that looks like. But, you know, I'm a strong believer that, you know, people in recovery, we're fighters, you know, we're soldiers. We've lived a life of tragedy and devastation and honestly miserable conditions. So when you get into recovery, it's really just kind of adapting and trying to move forward and really just stay connected. You know, my phone is constantly going off. I am a little nervous of, you know, with places shutting down, that means businesses may go out of business, which means some insurance people may not have. So then what do we have when people are reaching out for help, not having insurance, not working, falling further into an isolation, depression, picking up and using, and then when they reach out for help, it might be harder for them to get those resources. So that's my, I guess, futuristic kind of thing of my concerns coming up. Yeah.
Thanks so much, Brad. And Allison, you are up next. Welcome, first off.
Good,
And
I'm
then
glad I got here in time. Sorry about my tardy.
All good, all good. For those of you who have already made comments about treatment, and those of you who won't have the opportunity, if you have other ideas of, if we only had access to this, whatever the fill in the blank is for this, it would make a huge difference. So Brad, I heard you talk about, you know, cell phones or tablets or something for people to log in who may not have that ability to attend meetings. Or is it, you know, I don't know, a headset so that they could participate in their homes in the meetings without everybody overhearing them? Or what is it that, if there is something that we as a community could assist people who are really struggling right now, what would that be? And we're not going to have time to go around the table and discuss it, but if you would drop it in the chat, I think that would be very helpful. So Allison, how has Northwestern been navigating, you know, these services, these life-saving services with COVID?
Okay, so you know, I'll stick to the substance use disorder side of things. Psychiatrically, what we're noticing is that, of course, people with substance use disorder also have, you know, co-occurring depression and anxiety a lot of the time. And we all know why that is. So we are providing services for both. And what we're noticing is that, of course, it was predicted that the pandemic would create a big uptick in mental health problems. We normally see in October and November, you know, our uptick in everything. I mean, we're running high numbers right now, and that's typical for October and November, and everybody in the field also, you know, probably expects that. But what we're seeing is easily a 20% increase in demand over what it was even at our highs from previous years. And that's more so because of the mental health and depression piece of things, which does affect our substance abuse clients as well. And so what we are doing is, as Brad said, you know, people out there are hungry for human interaction. And we were initially in the pandemic just shutting everything down to telehealth in March and April and May, and we reopened in-person treatment. And except for, of course, you know, detox, you have to have people in a bed to do medical detox. So we continued to do that. But, you know, in our PHP and IOP programming, what we found with 100% virtual was that it's really difficult to engage people in the way that they need to be engaged, and especially in early recovery, as Brad was saying, in that format. You know, it's just not the same. People need community. They need the comfort of each other. They need to, you know, hear from people, you know, on break, you know, about how they, you know, what their situation is. It just makes them feel like they're not alone in this. I mean, a lot of times people feel ostracized and alone in their disorder. And so we got, you know, in person going again. And then one of the ways we did that is because of physical distancing, and we call it physical distancing because we don't want it to be social distancing. We don't like that word. So think of it as physical distancing. We're social, but we're physically distant from each other enough to be safe. So we have hunted and pecked and found some open floor space in some other buildings outside of our BHS or behavioral health building, so that we can expand our floor space and keep the in-person PHP IOPs going, albeit in a different place, so that we just have the room to see about the same number of people, but it takes more brick and mortar, you know, to do it. So we have begged, borrowed, and stolen stuff from other places like our computer training building and things like that to make that happen. And that's helpful. People really need that. Once they are more stable in their recovery, then they could potentially step down to a virtual program. We do have a hybrid too, you know, where we have, you know, you're here 3 days a week, you're out on virtual 2 days a week. You know, they just need to have the in-person piece. It has been a struggle though, to keep people physically distant. I'm not gonna lie. I mean, people want to cohort together. They want to get close, you know, we still allow smoking. So on the patio, we almost have to have a patio monitor to keep people 6 feet apart when they're smoking, because then of course the mask is off. So, you know, and pretty soon we're going to get cold weather. So we'll have to just keep dealing with that. Another thing we've done is that we have kicked our therapists out of some spaces that used to actually be patient rooms, and reconverted them into patient rooms in order to keep a single bed room situation going on, because that is what we need to do for detox. And so, you know, I moved my office. I'm in another building now because I don't need to be on site every day. And so we've done things like that. We have 14 single bed rooms where we used to have 10 double bedded rooms. So we're still struggling with being able to take enough people. Another thing we've noticed is that, unfortunately, in the substance use community, I think people are using longer, not seeking treatment early in the game because of COVID, because of not wanting to, I don't know, Brad, maybe you can help me. You know, you're really connected to the community, you know, to understand why people may not be seeking treatment in the numbers they used to until they really are severe. So what we're seeing is the severe people coming in, but not people who are maybe the day hospital level. You know, we'll see them more coming in at the inpatient level of clinical need than the PHP day hospital. So those are some things where, you know, we just continue to try to keep in person going safely enough, and so that people are engaged in their treatment and not relapsing. They were relapsing a lot when we had 100% virtual.
Thanks so much, Allison. And yeah, we're seeing that kind of across the board with physical health, mental health, and substance use. People are holding off on seeking care for all of those issues.
Mhm.
Dr. Wilson, I think we wanted to welcome a participant. So I'll turn it to you and then we'll get to a couple of questions.
Sounds great. Karen, I'm really enjoying this. This impact on the treatment community is so valuable. So thank you. I see that Dr. Rich Jorgensen joined us. We look forward to hearing from him when it comes to the roundtable. But, you know, Congressman Raja Krishnamurthy's office has been so faithful to the Hope Task Force, and a representative from his office is with us today. Leslie Ann Reese, could you unmute and just say hello for a minute?
Certainly. Thank you so much. We very much appreciate the opportunity to hear what all of you are saying. And I would like to just step into the first question and say that I am very grateful for everyone who is working in public service and for the fortitude that everyone is showing to be able to weather through all of these times. So thank you very much for letting me do this.
Perfect. Welcome aboard. Give our greetings to the good congressman. Karen, back to you.
Thanks so much. And I know we're a little bit over on our agenda, so we'll have just time for a couple questions.
Hey, Karen, this is Greg. Sorry to jump in first, but one question I had, and this may actually be something Leslie might be able to chime in on, is around the fact that we did get some good news regarding a vaccine earlier this week. I know there's still a number of steps that have to go before that's able to be distributed, but has there been any guidance given, Karen, to our health department, either from the federal government, the private sector, on the availability of vaccines and what the logistics will look like to get those rolled out? And the reason I'm really asking is because everything I've read and have been involved with is prioritize the most vulnerable in terms of being first in line for that vaccine, which they definitely should be. But what I'm hearing on this call as well is, people suffering from substance use disorder, they're definitely vulnerable in their own right. And has there been any discussion around allowing, folks suffering from that disease to have access to the vaccine before the rest? So that's a question I had.
Sure. So I'll have Chris address the, kind of where we're at with the vaccine distribution. In any of the documents and reports that I've had access to about vaccine availability and the stratification of risk and priority groups, there has not been mention of individuals suffering or getting treatment for substance use conditions as priority groups. It is primarily the long-term care facilities, residents and staff, healthcare, and first responders. But Chris, if you could fill us in on both that as well as a quick update on vaccines.
Yeah, definitely. And I'll put a link in the chat because there's some good, really nice information that CDC put out, I think just last week, on vaccine prioritization based on what we learn about vaccines. So to start, the decision about priorities for vaccines are led kind of at the national level by CDC and the Advisory Committee on Immunization Practices. And so when they will make a recommendation, it'll be based on the vaccines that end up getting approved. So how well do they work in different populations of people? If it's only effective in older populations, they may be early on. If it works better in kids might be prioritized. So we really need to know what vaccines end up getting approved to know how to recommend and prioritize their use. But in general, exactly what Karen was saying, the early prioritization looks at healthcare workers and those providing kind of critical infrastructure to make sure we can take care of people who are ill with COVID. And then looking at congregate care facilities. So that might be some residential programs or areas where people are at higher risk and living together in settings where they can't physically distance or they're at a higher risk for being in congregate living situations. And then priorities then go on to look at people that are at higher risk for severe outcomes. So that might be people with conditions, pre-existing medical conditions, substance use disorders, may be one of those. So we're really waiting first to see what vaccines end up getting approved. There's a number, you've watched media reports and understand that they're all being tested now. They're all recruiting participants to better understand how they work, make sure they're safe and effective. And then priorities will match kind of how those vaccines work. But check that link out there. There's kind of some guiding principles for how vaccine would be prioritized. It is our expectation, switching over to the logistics now, that there won't be enough vaccine for everybody early on. As production ramps up, there will need to be some prioritization because we expect, a small number of doses to become available initially and then be expanding over time. So there will definitely be some prioritization. We have been working with the state and health systems and health providers around DuPage to make sure that people are ready to immunize. So enrolling healthcare providers in the immunization registry, making sure they're aware of how this process will work. But a lot of the details and logistics are yet to be worked out because we don't know what vaccine will be approved. Pfizer's, you heard a lot about in the media, requires ultra cold storage. That's not a infrastructure we have readily in place across the country. So there's a lot of work going on to make sure that that's there. If vaccines that are more shelf stable at lower temperatures or higher temperatures are available, we have better systems for that. So a lot of it depends on what vaccines do ultimately get approved. Does that answer that, Craig?
It does, from my standpoint. Thank you, Chris. Thanks, Karen. Any other questions for Karen or the group before we move on to the next agenda item? Okay, and if anything comes up, feel free to put it in the chat. I know we're a very solutions-oriented group, so there's already been a lot of good discussion in the chat today that I think will give us some actionable feedback to take back and work with our representatives in Washington, Springfield, and here at the county. So thank you for that. Lanny, I hope you don't mind. I'll just jump into the next item here. I know we're a little behind on time. We want to leave some time at the end to talk about some other topics, but we're very fortunate to have Karen Kissel on the line from Haymarket. As many remember, this task force took a pretty outward discussion and stance on the need for treatment broadly in DuPage County last year, and that certainly is a need that persists today. I know Haymarket has been re-engaging with the Village of Itasca as of late. So Karen, I think you are on the line to give an update on the efforts that you're going through right now. So I'll turn it over to you.
Thanks so much, Greg. I had to go off video because the internet's not stable right now here. But as you may know, Haymarket Center purchased the former Holiday Inn in April, and we had to amend our application to reflect our ownership status. And despite setbacks due to the coronavirus pandemic, our hearings to the Village Commission restarted in October. We've had 2 hearings where we presented independent experts to the Plan Commission. Our independent experts, through testimony and extensive reports, continue to demonstrate that it's an appropriate site to serve the community and the region to fill unmet need, particularly with those who are uninsured or on Medicaid. We've tried to identify that our proposal of Haymarket DuPage satisfies the standards set forth by the village due to the distance from residential properties, location is adjacent to highway, busy roads, railroad tracks, the proximity to compatible uses, and we have an ability to operate without an adverse impact on property value, public service, and neighboring properties. We did change 3 portions of our application. One is because of the issues that the school district was talking about with us, we've decided not to accept women and children at the Haymarket DuPage facility. If a woman and her children present at Haymarket DuPage, we will transport them to our West Loop location where we will be able to serve them better. We also did formally enter into an agreement with Elite Ambulance Services to support Haymarket DuPage with our BLS and ALS emergency calls. Elite Ambulance is the 2nd largest ambulance provider in the state of Illinois. They have about 140 ambulances, and they already serve Forest View nursing home in Itasca, and they have been doing so for 5 years. They do about 110 calls to Forest View annually. And we also made a change to our outside of our facilities. Some of the residents and expressed concerns about fencing in the back, having landscaping. So we put in a patio. We're going to put in a patio. We're going to put in a significant amount of landscaping and fencing to give our patients privacy. you know, Haymarket has been around for 45 years. We're an experienced non-for-profit provider with a proven track record. And I think that's most evident in the broad support we've received from the medical community. If you look on our haymarketdupage.org website, you can see that the supporter list is growing, and we're so very appreciative. And I just wanted to say that we're grateful to Dr. Dan Sullivan, who's the Chief Medical Officer of Edward Elmhurst Hospital, for his testimony, and to Kara Murphy at the DuPage Health Coalition for her ongoing support. It's really been helpful to have those people standing beside us and supporting us as we go through this process. And since we've last spoken, Haymarket Center is partnering with Edward Hospital, Elmhurst Hospital, and Linden Oaks to address specific needs. So if a patient presents, has had an opioid reversal and would like to seek treatment, we are at these facilities and we provide support, and we transport these patients back to Haymarket West Loop. I can only imagine what that will look like when we are in the Itasca location. We'll be able to have immediate access to those facilities. We'll be in the hospitals, and we'll be able to provide a warm handoff in between the medical providers, the hospitals, the patients back to Haymarket. So it's going to be something that I think is really going to be amazing as we look toward the future. Our hearing that was scheduled for Wednesday was unfortunately canceled due to the coronavirus mitigations. We're hoping to resume on December 2nd and anticipate hearings through January 2021. And we're hoping that we're going to have a positive resolution to this process. It has really been a big undertaking, and but obviously treatment is necessary. There are so many people in DuPage and the Collier counties who need access to care, and you know, life-saving treatment is needed now more than ever. I think we've seen that across the state of Illinois, and Haymarket is vigilant in getting this facility up and running.
Thank you very much, Karen. Any questions for Karen? Okay, seeing none. Well, Karen, we really appreciate you and the rest of the Haymarket team and your engagement with this task force. We hope you come back and keep us updated as events proceed.
Thank you so very much. We appreciate all of your support. Thank you again. I'm going to sign off, but thank you for having us. And Dr. Lustig sends his sincere regrets. He's sorry that he couldn't join with you today.
No worries. Give him our best. Thank you.
Will do. Bye-bye.
Bye. Okay, moving on the agenda. One of the things that this task force is charged with, as we all know, is making determinations with how we should spend the $100,000 that the county board has allocated for grants related to fighting the opioid epidemic. And we have Mila on the line from the health department, who's going to give an update on two of the or three of the previous grantees that we funded in previous years. So Mila, I'll turn it over to you to go through that agenda item.
Thank you, Greg. Back in February, before we had COVID kind of change almost everything for us, we awarded 3 grantees with funding, and I wanted to provide you an update today on 2 of them, with the 3rd grantee having a larger update in January at our next meeting. The first grantee I'd like to provide you an update on is Access Community Health Network. Access Community Health Network was awarded funds to increase MAT services at the West Chicago location. If you remember, they have a program already started in Bloomingdale at the Russo Clinic, and the goal of the expansion funding was to provide West Chicago, which is a community very close to our health department location here in Wheaton, the ability to provide telehealth and in-person MAT treatment. So while COVID has presented problems with getting that program kind of off the ground, they have come a long way in providing initially telehealth and now in-person MAT services at the West Chicago Clinic, which is exciting. I can share a link later on where you can find a description of their services on their website. They have been out in the community providing palm cards, and we have had a couple of virtual meetings allowing them the chance to talk to referral partners and the community about their services in West Chicago. So we're excellent. We're really happy to have their services expand to West Chicago and offer a second federally qualified healthcare center that offers MAT in DuPage. The second grantee that I wanted to talk to you about today was the DuPage Health Coalition. So the DuPage Health Coalition, and this project is being spearheaded by Karen Murphy, was funded to provide X-waiver education and to increase the number of different providers that can provide MAT in DuPage County. So what they did was they started with emergency room department staff and offered X-waiver education and certification to those staff members. They have trained 44 providers in an MAT now, and they have their X-waiver. Some of them are still waiting to be certified, but there's 44 that have gone through the training, and they have another training scheduled coming up next year that will increase that number as well. So we are excited about how this program has launched because they have been able to spread that training across 7 DuPage healthcare partners, including Good Samaritan Hospital, DuPage Medical Group, Northwestern Medicine, DuPage County Health Department, Access Community Health Network, Edward Elmhurst Health, and AMITA. Interestingly enough, outside of DuPage County, they have also had reach into the Spokane Department of Health and the Princess of Wales Hospital in the UK. So there's the power of social media and virtual training for you. So it's really exciting to see this because we have had a lot of providers come together and say, well, we can do this in the ED, but where else can we provide an X-waiver provider? So internal medicine, including hospitalists, have been trained. There have been providers trained in neurology and psychiatry, family medicine, and obstetrics and gynecology. So that's an exciting update for us. We should have a more complete report from them at the next meeting, but that is the report from the DuPage Health Coalition and from Access Community Health Network. The third grantee was Edward Foundation, and that program was designed to bring refuge recovery and smart recovery to DuPage County, and they are trying to put together a more solid plan on how to engage folks in recovery through virtual platforms, because for new programs to start up with recovery and training, the COVID situation has made that difficult. So I'll have a more complete report for you in January.
Thank you, Mila. To make the transition from item 6 to item 7, Greg and I are co-leading. And so take a deep breath, Mila, because you're back on for item number 7. Tell us what's happening with the Narcan program.
Yes, I'm happy to report to you this morning on the DuPage Narcan program. When we spoke last in July, we talked about how training had to be done virtually and that we had added trainings to our Hope DuPage website, both in English and in Spanish. So our thought was to provide training that could be available to people kind of around the clock, and they could view it from their phone or from their computer. They also could join in with us on a Zoom call or just on a phone call to walk them through the training and receive the Narcan either curbside or by delivery. So we're really excited about how that has launched because we've had over 1,000 page views to the training website that has all those videos listed there. The other piece of that to make it a little more cohesive for some of our participants that are involved with our correctional system, we have had the trainings led by Andy O'Brien, who works in our drug court and is a well-experienced behavioral health counselor here at the health department, and also Amy Coleman, who's the reentry specialist at the DuPage County Correctional Center. So by providing their voices and their training, it allows people that are in the jail and may have received the training through the recovery pod, but haven't received the Narcan yet, to reach out to us, receive that Narcan, and then view the training again. They can also share it with family members and loved ones. Additionally, I see Tim McGavin on the call, and Tim has been working closely with us through probation to make sure that folks participating in the probation program are also able to receive Narcan. We're really excited about that partnership because there was an impact to folks in probation and coming out of the correctional center during the spring, when we knew that Narcan was an essential part of having them get into recovery or to stay safe. Additionally, we have given police departments, and I'm going to hold this up, so this is kind of, hopefully you can see this at least a little bit. We have created a pocket card for police departments to provide at Narcan reversals as a leave behind. And this idea came from working with Lisle Woodridge Fire Department. Chief Preston mentioned John Caldwell earlier today of one of the things he was thankful for. John Caldwell had started a Leave Behind program with the Lisle Woodridge Fire Department, and they created actually their own sheet and form, which allowed us to partner with the fire department to provide Narcan training. So that worked really well, and Chief Preston may jump in and share how well that's worked. But we have since done the same with the police department, and we've had a number of folks from the police department reach out, and it is amazing to see how people respond when a police officer comes back to the home and says, you know, Narcan is something you should have at home. It would really help you. And we've been able to help a number of people, including resupplying their Narcan as needed. Chief, I think you might be on the line, and I don't know if you were trying to jump in there.
I gotta go. Kim, I gotta go.
Chief Preston? Okay, he went back to mute. So that Leave Behind program is an important part of how we're trying to function.
I'm sorry, Penny. I'm here.
Hey, Chief, I was just talking about John Caldwell and the program that you started, the Leave Behind program.
Yeah, I know. I'm listening. You want to share with the group real quick that some of this training has been done in unconventional means. John actually met a family at the Walgreens, got them the Narcan prescription, got them trained. They subsequently moved to Tennessee, and the individual had a overdose, and mom was able to use the Narcan and the training that she used, and was able to reverse the overdose, and the person survived. So even outside of DuPage County, we're making a difference, which is really good. That's why I mentioned John in the beginning of this meeting.
Thank you, Chief. So, you know, this program has always relied on first responders, beginning with police officers and now engaging fire and EMS. It's a big part of what we're doing because that is the first line of defense for somebody when 911 is called. So we're really excited to have our participation from law enforcement grow. We have recently brought on new law enforcement programs. So we now have a total of 93 participating program sites, which is up from 82 last year. So, you know, that list of law enforcement and first responder groups just keeps growing. We've brought on Naperville Park District Police Department, Andy Frayne Security Services, a number of different folks this year. So that is a big part of what we're doing. To address treatment groups, treatment programs in DuPage County, especially those that serve DHS programs and Medicaid, the state made some funding available to us in the spring that allowed us to provide 2 Narcan kits per client to 5 treatment programs in DuPage County. So those 5 treatment programs are Haas, Stony Brook, Symetria, New Age, and CAP. Some of those treatment programs do a little bit of harm reduction along the way, especially when people are in
talking with that thing on.
maybe a crisis mode and unable to stay in treatment. If compliance is an issue, they are able to provide Narcan as someone is discharged. So that program that the state made available, we consider it a part of the rapid deployment program of Narcan. The last expansion of the DuPage Narcan program has been to some of our hospital partners. This is something we've been working on for some time. Good Samaritan Hospital became the first hospital to train their emergency department physicians and nurses and provide Narcan and dispense it to people that come in with an opioid overdose or anyone else that they think would need it. So they started that program in July, and it's been going very strong. They do a number of different training sessions, both virtually and in person with their staff. And then there is a folder, both English and in Spanish, that goes home with the person with the box of Narcan. Then recently, Edward Elmhurst Health System also came on and is providing Narcan at their emergency departments as well. So that's now 3 of our hospitals that are offering Narcan at the emergency department when someone is discharged. So we're hopeful that that will continue to expand. We are using our state funds to provide that Narcan. So in summary, we have had 962 successful opioid reversals since the program started. So that's since 2014 until the month of the end of October. We've had 962 reversals. For this year in 2020, we so far have 161. We are seeing a little bit of lag in reporting, which is to be expected given everything going on with COVID. So we may or may not end up increasing our total from last year of 207. But I'll have an update on that for you in January. That's the report I have this morning. Thank you all, and I'm happy to take questions if there's time.
Thank you, Mila. Maybe during the roundtable discussion, we can readdress. You're a real champion. Your program, we're about saving lives here, and you just described many lives that we've saved through your program. Your partner, Chris Huff, is up next. Chris is going to tell us a little bit about this year's HOPE Grant application review.
Yeah, thanks, Dr. Wilson. And I'm excited to share an update with you all. Since the last time we met, we opened the call for applications for the 2020 grants through the HOPE Taskforce. If you remember, the county board had generously made $100,000 available to be able to fund programs that would address the opioid crisis in the county, and empowered the HOPE Taskforce to collect those applications, work with organizations, review, and then make recommendations on where those funds should go. And so in September, we opened the call for applications. Again, we were looking for community-based organizations or licensed substance use program providers to apply for these funds to address the opioid crisis in DuPage County. We asked for applications over the period of about 45 days, collected applications in October, and got 5 good applications from community organizations. So we are excited to be able to offer these. It's obviously always a challenge to identify how best to use those funds to help organizations to do them appropriately and find ways to engage them in the work in the county. We had a great review committee, so I want to call out Brad, Jeff, and Chief Creston for joining some of the health department staff in reviewing those applications and scoring them and making some really tough calls on funding. We are happy to announce that there are 3 organizations that will be funded through this round of funding. Those were recommended to the DuPage County Board of Health last night for their approval. They're the ones that actually enter into the contracts. So the 3 organizations that will receive funding in this round are DuPage County Adult Probation for a peer recovery coach program, partnering with 40 probation clients with a peer recovery coach. To be able to provide a little bit different perspective to those clients than just a probation officer, but really linking them to somebody that has some lived experience. The second group that will receive funding is Serenity House to expand a medication-assisted treatment program. They have started to admit and work with clients who are already on a medication-assisted treatment therapy and will now continue those services for clients that are engaged in residential programming at Serenity House. So a further expansion of our ability to provide an evidence-based treatment for people who are struggling with a substance use disorder. The third group is the Path Recovery Foundation to provide some additional peer-based recovery support services to individuals, both in the community and coming out of the jail. Again, trying to provide some additional support for agencies that are working directly with clients in a support role, helping them navigate the complexities of treatment and benefits and other resources that may be available. So excited to announce those 3 and share those with you. We will be working on some more formal communication to send both to you and out to the community to recognize those groups. Obviously, we'd love to fund many more, and so we're looking forward to an additional round of funding in the upcoming year. One area that we want to work more with the task force on, specifically at our next meeting, is around harm reduction. Looking for specific opportunities to fund some really discrete programs in the county that might make harm reduction services more directly available to residents. Obviously, there are issues on both sides of providing harm reduction services, things like needle exchange, test strips, Narcan directly to individuals in the community. We'd love for the task force to spend a little bit more time looking at how that might look in DuPage County, where those services might be offered, what types of organizations would need to be engaged in that work, and look at a potential funding round early next year to extend some additional dollars for those types of activities. So I want to thank the grant review committee. I want to thank everybody that applied for those grants and recognize the DuPage County Board for their leadership in providing funding to the task force to be able to implement these programs through the community organizations. We've had some great success so far based on what Mila shared from our previous rounds. We're looking forward to exciting news from these 3 programs. And we'll be working with both the agencies that were funded and those that applied and were not funded to ensure that these programs can continue in some way. I'm happy to take any questions on that now or give an opportunity for the grant reviewers to add anything I may have missed. Brad, Jeff, Keith, anything you'd like to add?
You did a great job. Thanks so much. We'll have more discussion. I think there are some questions that came out of that review process that we'll want to bring up at our January meeting, but a great review. Look forward to further discussions and what this group will do with those precious dollars that the board has provided.
Thanks, Lenny. And if I can, I just want to recognize and appreciate Sarah Troll from the Health Department who led the grant process. She did a lot of work behind the scenes on behalf of the task force to solicit those applications, collect them, help the reviewers. I'm not sure if she's watching the call, but I just want you all to know that that takes a lot of time and effort, and she really did a great job supporting that process.
And Chris, you took the words out of my mouth. I was going to recognize Sarah. She made our jobs very easy. So Sarah, if you're watching, thank you very much. And the hardest part about getting so many great applications is making these decisions. And we know that there's a lot of individuals and organizations who applied. Even though you weren't selected this time, we don't discourage you to apply again, because we're really interested in making sure that we're getting innovative ideas that we can help support in DuPage County. So really excited about these 3 grant recipients. I think they're going to make a lot of helpful impact, especially at a time where, as we know, with COVID, this issue is even more important than it ever has been. So thank you everyone that participated in the grant review board, and you'll be hearing more communication about our great grant recipients over the coming weeks. So seeing that we have about 13 minutes left, I did want to give some time to a roundtable, and I'm going to kick that off right now. And I know our state's attorney, Bob Berlin, is on the line doing some great work. And Bob, I think you may have some updates on some potential or existing lawsuits that I know the state's attorney has been involved with. So I'll turn it over to you first, and then I'll go from Bob to left to right on whoever is on my screen.
Sure, thanks, Greg. So everyone will recall we filed, along with other counties, a lawsuit against many of the manufacturers and distributors of the opioid medication. Our lawsuit was filed in DuPage County, but it was transferred to Cook County for discovery purposes. It has been stayed after Purdue Pharma filed for bankruptcy, and that's kind of where it stands right now. We did file a motion to lift the stay, and that is currently being briefed. And it's going to be heard in front of Judge Flannery, who's actually the presiding judge in the law division in Cook County. I spoke with our special assistant state's attorney, Pete Flowers, yesterday about the case, and he assured me that he is pushing hard to move our lawsuit forward. Ultimately, he and most of the other plaintiffs' attorneys believe that there will be some type of a global settlement here, but that's still a ways off, and what the framework of that settlement is going to look like at this point is still unknown. I do want to mention 2 other things, Greg, if I might, and that is just an update on our drug court and our focus court. Our drug court with Judge Athanakar now presiding is getting more cases and continues to be very successful. We have 61 current and active drug court participants, 46 pending applications, and 6 applicants that are ready to execute a contract within the next few weeks. So it is likely that we're going to get over 100 cases in our drug court hopefully soon. And 14 have already graduated the program this year. It's doing extremely well. And thank you, Bernadine, for everything you do. And then our focus courtroom has 403 pending predisposition cases and 610 post-disposition cases. So we're over 1,000 cases now pending in that courtroom, which is all of our first offender drug probation. And these are cases where if they complete the program, they can have these cases ultimately expunged from the record. So again, I think we're doing great work in the criminal justice system dealing with this problem.
Thank you very much, Bob, for that update. Great work as always. And anyone have any questions for Bob? All right. Well, thanks again. And we'll move on here. I know Andy Anselm is on the line, and I see him next to my screen. Andy, I'll turn it over to you to give some updates. I think there's some particular information around some interesting trends we've been seeing in terms of drug use recently in our community. As we all know, we're here because of the opioid crisis, but the way that it works is that we have to keep an eye on different trends because we're really focused on substance use more broadly. So Andy, I'll turn it over to you if you have an update.
Good morning. Yeah, one of the things to bring up, I don't know if anybody's seen it on the news or heard about it, but we're getting a lot of counterfeit oxycodone pills, the blue M30 pills that are coming back from the lab as straight fentanyl. We're trying to work a few of those cases now. We've already seized a few hundred pills from people, and it's definitely one of the concerns. We've had a couple overdoses in the county, I know, and then there's been quite a few in Will County where it was the counterfeit oxycodone pills, which are coming back as straight fentanyl. And we've probably been seeing them for about a month or so. Other things that we're seeing, which is, again, isn't related to necessarily the opiates or overdoses, but LSD has made a huge comeback. We've seized more this year, 3 times as much than last year already, even with the slowdown due to COVID. It's everywhere right now. And then just to hit on something different that Neil asked me to bring up. So DUMEG is a member of the Chicago HIDA, which is a high intensity drug trafficking area. We get some funding for that for overdose investigations and also for other narcotics investigations. They are trying to expand their prevention footprint into DuPage and maybe some of the other surrounding counties. I've been talking with Jory Esser from the prevention leadership team about that, and she was going to talk with Candor. So what HIDA is currently doing is supplementing some of the cost to have Candor come in and teach high school students and go over, do some prevention classes. So that's something HIDA is interested in doing. They're not sure of exactly how it would work in DuPage. Most of their work right now is with lower income high schools in the city, and they're supplementing where schools cannot afford to have Candor come in and do their program. HIDA's also started putting virtual boards up on 290 and 55. They have quite a few up now. There's about 6 or 7 of them up related to drugs and how it relates to violence. And then there's also a few up with overdose information that I'm sure you guys have seen on 55 and 290.
Great. Thank you for that update, Andy.
That's all I had.
Okay. Thank you very much. And that we'll continue to keep an eye on everything you said. I think it's helpful for the group. So in 5 minutes, I know that's harder. We have more than 5 people on the phone, but we'll try to be judicious with our time here. I'm going to go to Mila next, so I think I had 2 other updates, and then I'll turn it over to everyone else on the call, either to provide some information that you'd like to share with the group, or not any information that you'd like to share. Potentially what topics or areas of conversation we'd like to see at our next task force meeting that's coming up in January. But Mila, I'll give it to you quickly to run through your updates.
Thank you. Just 2 quick ones. The first one piggybacks off of what Andrew Anselm had just mentioned about education, how important that is right now for young people, both in high school and middle school. So what I wanted to share is that we have provided schools, health teachers specifically in DuPage County, with virtual education using tools that they already have. So Kahoot quizzes, virtual platforms, recorded trainings that they can utilize in their health classes right now. And we'll be sharing more about that in the next 2 months. And then the second update is related to a survey, which is now on our Hope DuPage website under the purple button called Share Your Feedback. And the purpose of that survey is to get feedback from the community. So as much as I'd love feedback from all of you, what I would really like you to do is promote that survey to the people you work with, that you are friends with, because we need to know more about how drug use impacts DuPage County residents. So Laura Crawford, as I'm looking at you, I'm thinking businesses would be an excellent opportunity to get more feedback from the business community. Certainly this is an issue for their employees of all levels. So I'm thinking about that. I'm thinking about people that work in social services and other areas. So I'm going to share that link either through Penny or from myself directly with you. And if you wouldn't mind sharing that survey, I would greatly appreciate it. Thank you, Greg.
Thank you. And Laura, how about we turn it over to you next? I think I saw you trying to say something anyway. So any updates you want to share?
No, I was just responding to Karen's comment about the family perspective, and I was congratulating her and all of you on your work, because it's been 4 years since my son died this month, and I cannot believe the opportunities for families as well as addicts in that short period of time. I'm just thankful and grateful, very grateful for that. As far as it applies with business, I hear it from restaurants. You know, the restaurant industry is often part-time. They're often, their employments are very young people. And not that that makes a difference, but it kind of does. And so there is a great concern in that area, and anything that we can do, you know, to keep the awareness up in that regard, I think would be important.
Laura, we're happy to work with restaurants and banquet halls and anybody else that may have staff that are interested. So I'm happy to reach out to you. Thank you.
Good. Thank you.
Thank you, Laura. Deb, how about you? Anything you want to share?
No, I want to thank you for picking Path to Recovery for the grant. We are so honored and humbled. I just want to share that, yes, it is really bad out there. Families are falling apart, just as our loved ones are. Been doing a lot of Narcan training on my front porch. So you got to do what you got to do. But thank you. Have a great weekend, everyone.
Thank you, Deb, you as well. In the remaining 3 minutes, Mayor Veenstra, I know you've been on the line. Anything you'd like to share? We're always appreciative of your participation.
No, the only comment I would make is that, you know, we've been spending a lot of time, we as mayors, with the COVID issue. And, you know, I'm thinking that we've got two different groups working. There's a lot of room for articulation and, you know, the outreach that's being done for COVID. Maybe we could piggyback a lot of the information that we need out based on our task force with the initiatives for the COVID and work together and maybe get a little bit more synergy as a group.
I think that's a great idea. And Mayor, as you know, prior to the pandemic becoming top of all of our minds, we had planned as one of our Hope Task Force initiatives to do town halls across the county. And I know Addison was actually slated to host the next one. So while these issues are different in many people's minds, in many ways they're linked, as we've talked about. So I think that's a great idea. And maybe Mila, Chris, Lanny, we can sync up with the mayor and talk a little bit more about how we start coupling those resources with regards to COVID and substance use.
Yes, thanks.
Thank you. Tim McGavin, how about you? I'm calling people and putting them on the spot. If you don't have anything to share, it's fine too, but just want to make sure everyone has a chance to talk.
No, thank you, Greg. Much like Deb just said, we are very honored to have been chosen to be a recipient of one of the grants. We know that the relationship between the probation officer and the client is very critical, but there's some parts of that relationship that a probation officer just can't get into, just because of the nature of the court and the system that we have. So we really feel like having a recovery coach is going to be instrumental for us to reach. And we've identified potentially up to 40 very high risk clients that in the past year have tested positive and or have been using fentanyl, maybe not even realizing they're using fentanyl. So that's where our efforts are going to be, and we are very appreciative of that opportunity to do that.
Thank you. We're excited as well. Okay, I know we're at time here. I'll open it up to the floor. Any other comments, questions, thoughts from any members of the task force that haven't spoken yet?
If I may, just really quickly, I just wanted to give everyone an update. We are still Gateway's still planning to open the outpatient center in Downers Grove on Finley Road. We've had a few delays, so it got bumped from November to January, but we are on track for a January opening for outpatient programming there. So
great news.
This is a great culture of collaboration, Greg. I love the way that DuPage County collaborates so well. Our next meeting is January the 22nd, so everybody put that on your schedule for 8:30, January the 22nd.
Thank you. Well, we appreciate everyone joining. We'll see you in a few short months here. And of course, if anything comes up in between meetings, don't hesitate to reach out. I think we got a lot of good action plans that we'll take from this meeting and hopefully get some more updates in January. But have a great weekend. Happy Thanksgiving if we don't talk with each other, and we'll see everyone soon.
Thanks so much.
Thanks.
Stay well.
Thank you, everybody.
Everyone,
Take
happy
care.
holidays.
Thanks, everyone. Thank you.
Thank you.